This Week in Richmond is made possible in part by the Virginia Education Association. An investment in teachers today will pay dividends tomorrow. Dignity Memorial. The Dignity Network provides professional and compassionate funeral, memorial, cremation, and cemetery services throughout the Commonwealth of Virginia. Virginia Hospital and Healthcare Association for jobs, the economy, and public health, committed to advancing health and economic opportunity for all Virginians. Virginia Tourism Corporation, promoting why Virginia is for lovers, lovers of wine and craft beers, the outdoors, beaches, history, music, and more. Fall in love with Virginia at virginia.org. Additional support provided by these sponsors. And by the members of Virginia's public television stations. Thank you.
Welcome to This Week in Richmond. A very special welcome to three guests who are going to talk about the hottest issue in the nation right now, healthcare. And we'll get into some aspects of healthcare initially. But first, let me welcome Senator Louise Lucas. First elected, began serving in 1992, has chaired the Education and Health Committee in the past, is one of the ranking members on that committee, as well as serving on Finance Committee, Commerce and Labor, Courts Committee. Marvin Figueroa, Deputy Secretary of Health and Human Resources, with a career of 7 years or more with Senator Mark Warner working on healthcare issues, and Dr. John Yosay, who's from the Colonial Heights area, Southside Regional Medical Center, Southside Primary Care, and appreciate each of you being here. And the aspect of healthcare that we want to get into initially, and it may take our entire time, is what's happening with Medicaid and Medicaid expansion. And Senator Lucas, if you would start us off in the conversation about why is this happening?
Thank you, David, and I'm glad to be here. Well, I've served in the Senate of Virginia since 1992, and by far, expanding Medicaid has been one of the most consequential pieces of legislation that we passed in my 26 years in the Senate. And I can tell you it was a whole lot of compromise on the part of both sides of the aisle to get through that. And I'm extremely proud of the way we worked in a bipartisan way, and especially at a time when people are just disillusioned about government and about elected officials even working together. But I am extremely proud of the effort that we put forth in order to get it passed in the Commonwealth of Virginia this year.
I was thinking about who, what, when, where, why, and how, but I wanted to start with why. So let me get the two of you involved in the conversation with Senator Lucas. Why is this happening? Why is Virginia expanding Medicaid? Marvin?
So I'll start off a little bit. First, David, thank you for allowing me to be here, and it's so good to be sitting next to Senator Lucas. Long before I started at this job, I knew about her, and I'm so glad we've been able to work on this project together, and we've been able to work a lot on expansion, especially around the provider assessment with the VHHA. So thank you. I think this is a big time to be in Virginia, a great time to be in Virginia, especially around healthcare. To be honest with you, when thinking about Medicaid expansion, we know we've done focus groups to kind of think through what individuals are going to benefit from this care. These are individuals who are working, right? They work in retail, they work in childcare, they work in construction, but for some reason or another, their employer does not provide health care. And so with Medicaid expansion, these individuals will be able to have access to care that for a long time they've gone without having, which we believe is going to be a value add to their ability to continue to be contributors to the Virginia economy.
And you see it really from the practitioner side.
Yeah, sure. So from the perspective of those of us that provide healthcare, it's all about getting the folks who need access to care. Far too often we see patients utilize the emergency room as their only source of medical care. We all know that's a very expensive form of care and not the most efficient way to provide it. So from my perspective, it's really about getting folks right care in the right setting.
Well, you know, healthcare is a life and death situation for a lot of people who are sick and people who are hurt. And Medicaid expansion is going to provide the kind of care that will keep people out of the emergency room. Like, for example, in my district, if I were to go from Portsmouth down to Emporia just alone, we're looking at about 14,000 people who will benefit from Medicaid expansion. And that's only just a small part of my district, as you know.
You're talking about life and death. I'm remembering the conversation, the discussion on the floor of the Senate in which one of your former colleagues, who's now a member of Congress, talking about the health care that was provided to him. It was in an extreme emergency area, and that if he didn't have health care insurance, I mean, he wouldn't be able to get that. So it really can come down to life and death.
Absolutely.
So let's go to the who part then. Who's really going to be, Marvin, you laid it out in some terms, but who will now become eligible to receive Medicaid?
So it's individuals that are 19 to 64 that are not in Medicare, and they have to meet the income requirements to be eligible. There's also, and kind of one of the biggest differences too is that now childless adults will be able to qualify. So if you have an income about $16,790, don't quote me on that, but I guess you will, then you will be able to qualify. And so what we're trying to do right now is make sure that individuals understand the new rules, right, because the rules have changed. We're encouraging everyone to go to coverva.org. There's a toolkit there where you'll be able to plug in some of your information and you can see whether or not you're eligible. But also encouraging folks to go to their local DSSs, bring the necessary paperwork, and kind of talk to your DSS worker so you can figure out whether or not you'll be eligible. And so that population is going to be the one that's going to benefit the most.
Yeah, so we'll have that website up quite often during the show that people can see it. And I think you gave another way people can do it if they don't have a computer with maybe some high-speed access, that they can go into a local office.
Local DSS. And we also have a call center as well. And through a call center, we'll be taking calls. And again, we'll have enrollment officers there that will be able to provide the information for individuals as to what they need to qualify. And so we have 3 ways that individuals can again enroll. It's going to be through the phone, in person, or through CoverVA.
So when this happens, how's it going to impact hospital, say even the emergency rooms? Does that mean you think less people will be using that?
Yeah, the hope is that less folks will use avenues of care like the emergency room, and it'll transition more to the primary care role. Patients will hopefully establish care with the primary care physician. That will allow them to get their medical needs met earlier, sooner, and before they become too severe or an emergency situation where the care is, like I said, more expensive and less efficient.
And just to piggyback on what he just said, that's going to free up more money in the Commonwealth to do other things that we need to have done. And the thing that's near and dear to my heart, it is also going to create thousands of jobs for people all across the Commonwealth. And that is extremely important. That's another positive aspect of getting Medicaid expanded in Virginia.
You hear at times, and I don't know, each of you can speak to this, but that not all physicians accept Medicaid. So is this going to be a challenge in some ways?
It will be. I know Dr. Carey and his staff, along with Dr. Lee and her staff at DMAS, have traveled around the state, talking to physicians, talking to providers, asking them, please consider expanding the number of Medicaid patients that you see, because it's one thing to provide this care to folks, but we need the physicians, we need the providers to meet that need.
I guess the challenge for physicians, and again, you know that from your experience, is that the Medicaid reimbursement would not be as much as perhaps it ought to be.
And that's a struggle that we have. I mean, there's no doubt that your commercial insurance payers reimburse at a higher rate than Medicaid does. But I know I don't want to step on the legislators' toes, but I know there are some efforts to improve that, to improve the Medicaid reimbursement to attract some more providers to take on that increased demand.
You're correct. There are some of us.
Yeah. I can't say enough about the partnership that we've had with VHHA and with our health plans to kind of get at the issue that you just described about providers. And we're also starting to engage legislators so they understand the importance of physician reimbursement in this whole process.
Does Medicaid carry any kind of a negative connotation in the minds of people that needs to be overcome, or do you think it will be fully embraced? And maybe you know some information about this in your work with Senator Warner and other states that have already expanded, but Medicare, people look at it in one regard. Sometimes Medicaid sort of looked down upon at times. What is that also going to be any kind of a challenge, or do you think people are going to embrace that opportunity?
It's been my experience that even people who at one time might have been naysayers, they have family members, friends, and know of people who are in need of health care, and that they're becoming more and more receptive to the idea of having Medicaid expansion, because it's going to help increase the longevity for people that they love and care about.
The other thing, there are so many folks that are one accident away from financial catastrophe. And that's where this is going to be it's a huge benefit for financial stability for a variety of different residents that will hopefully have that coverage and avoid that risk.
Yeah. I think the only thing that I would add is that, interesting enough, I used to work in the Senate last year. I was in the Senate last year working with Senator Warner, and the repeal debates around repealing the ACA, which included a cap on Medicaid, increase the visibility of the program, right? So folks that traditionally didn't know they had Medicaid, right? For example, for paying for nursing homes, realized that it was Medicaid that was paying for their nursing homes. And so, right, in a way, kind of that galvanized individuals run a program that traditionally, to your point, has been misunderstood.
And that's the reason why the process of educating the public about what Medicaid expansion really does has been so extremely important. Because for many of us, we've had to go out and sell this idea to people who actually already benefiting from the program.
Yeah, certainly. Right on.
Pre-existing conditions, are those covered? What, let's say that I'm eligible and I'm signing up. Are there limitations of what Medicaid will cover for me when I come to see you, doctor?
From the primary care perspective, no. I mean, Medicaid will cover your primary care services, your preventive care services, and then beyond that, specialty care services as well. I mean, wouldn't be able to itemize what is and isn't covered, but the coverage is robust. I will say that.
This is me selling the website again, but Cover VA is where you can find a list of covered services. And so it's important for your viewers to understand how important that website is going to be. I think from your question about pre-existing conditions, Medicaid is a program that covers pre-existing conditions, and there's no health underwriting, for example. And so it's essential for individuals to understand that they will get the services they need. So Cover VA is a good website to go to.
And it's going to be robust enough that it won't crash, right? Because we remember years ago certain websites crashing when people were trying to get on.
Don't remind us.
The Affordable Care Act back in its very beginning. So the time is right now that people can start. I mean, they can go on that website, but they can sign up right away. And I think the date's November 1. They can really start that. And then the coverage begins in January?
1st, 2019.
Yeah.
Programs like the one that you're having this morning is going to be crucial for a lot of folks in terms of having them be educated about what is available and how they can access this service. And so I'm just so extremely grateful to you for having us to come on to do this, because it helps in that process of making people more aware of what services there are and when they can enroll. That's important.
Well, I appreciate the three of you coming on, taking your time, and our viewers seeing the show, and they're appreciating it, and then they're passing the information on, particularly the website, to friends and to colleagues. I'm sure there will be many people that will be checking to see if they qualify, and some won't because of earning a little bit too much. And what happens then? Is there a gap that you would see, or policy-wise that you would see between the individual who doesn't have insurance, but who's earning $20,000 or so, and the employer is not providing the insurance? I guess my main question is, do you still see a gap of people that really probably won't have access to family physicians?
Right, so we're doing our best to address that gap through Medicaid expansion. I think there's going to be a gap, right? There's going to be individuals that, because of income eligibility requirements, won't be able to qualify. I think it's important in this debate to acknowledge that there's always going to be a place for the social safety net, and we have to continue to strengthen that social safety net, because there will be individuals that won't have insurance. We're also thinking through, what is the transition for those individuals, right? We have programs in the past like GAP and Plan First that be able to cover at least limited benefits. I'm not necessarily sure what's going to be the future of similar programs in the future, but again, there will be a room for the social safety net, so we have to acknowledge that up front.
Senator Lucas, you began talking about the compromises that were made, and one of those compromises that enabled people to come on and have a majority in both chambers had to do something with a work requirement. But I'm hearing you talking about people that are working. So what's going to be happening policy-wise and administration-wise, and it will affect people who maybe are not working?
We're going to have to take a deeper look at that. And the reason I say that is because everybody who is unemployed is not employed because that's the lifestyle they choose. Some people are physically not able to work. So, maybe, I don't know whether we do a case-by-case basis, but there needs to be some process that ensures that people are, in fact, not able to work before we just completely disregard them.
Yeah. And I think I want to emphasize as well that the budget as laid out establishes two parallel tracks, right? So we have a state plan amendment process that allows us to do enrollment, and we were able to get the requirements in order to move forward with enrollment. And so that's the announcement that you heard on November 1st from the governor last week. The second process is kind of the work requirements or community and work requirements. That's the 1115 waiver. That is an ongoing negotiation between the state of Virginia and the federal government to be able to get permission to impose work and community engagement requirements. And so right now the focus is on enrollment, and we're going to continue working on those work requirements. I think it's important to acknowledge up front as well that once we put those work requirements in place, there will be individuals that are going to not qualify for Medicaid because of the work requirements. And I think it's important for the General Assembly and for the governor as well to work together to figure out what is the path forward for those individuals, because we have to make that tough choice.
Well, you're providing some information that maybe everyone's not aware of, and that is the federal government hasn't signed off on that yet.
They have not.
So that's still in progress.
Yeah, so we have an open comment period right now. So we put out the 1115 waiver for individuals to comment, to get feedback on it. The next stage is we're going to respond to those comments, and then it goes to the federal government for them to also have a federal open comment period. And so again, it's an ongoing process, ongoing negotiation, but right now our focus is on enrollment.
Senator Lucas, you rolled out some numbers right at the very beginning of people, even in your district, that could qualify out of a number that's often used of about 400,000.
400,000.
I guess they're across South Side, but are those numbers of people throughout the Commonwealth? Are they predominantly in certain regions?
Well, there's certainly, a socioeconomic, distribution as far as who would benefit the most from this expansion. I can speak to kind of the Tri-Cities area in particular. We estimate a little over 16,000 people will be eligible for care come January 1st. We talked a minute ago about things that people don't necessarily recognize. One thing I wanted to mention is it's not only those folks that are eligible for this new Medicaid expansion that will benefit. All the hospitals across the Commonwealth are required to provide care to patients regardless of their ability to pay. What ends up happening is that hospitals have a lot of care that they provide that goes uncompensated, and those costs have to be absorbed somewhere. So if under Medicaid expansion, hospitals will be in a better financial situation, and then ultimately those cost reductions can be passed on to everyone, not just those that are benefiting from Medicaid expansion.
When you mentioned Tri-Cities, because there may be some other Tri-Cities around the Commonwealth,
sorry.
you're primarily talking about Richmond?
Oh, Colonial Heights, Hopewell, and the kind of Prince George area in Petersburg.
Oh, okay. So those numbers didn't include the city of Richmond at all.
No.
You're not. Okay.
No, and I speak to that area because that's the
area
the community that I serve that are most directly impacted by. So.
Yes. The upcoming session of the General Assembly then still would have some things maybe to wrestle with on this. Is that right, Senator Lucas?
There's no question about it. I'm sure there are going to be a lot of issues on the table that we're going to have to wrestle with, and we're going to be counting on you to help guide some of them.
Yes, ma'am.
Okay.
Some of them may be budgetary, do you see?
Absolutely, when it comes to the budget.
Because one of the things that, and I haven't seen anything or read anything, but I think I did hear from even one of our guests a few weeks ago that some comments that hospitals may have to upfront some money in this process, and so I don't. There's still things to be negotiated and worked out even on that, perhaps.
Yeah, and I mean, I want to again talk about the relationship with the VHHA and kind of the governor's office. We've been working really well on the provider assessment, which is what I'm guessing that you're referring to.
Right.
Our teams are working closely to make sure again that this rolls out smoothly and that there's a common understanding between the two parties. And so I can't say enough about kind of how well we've been working together.
So someone checks out and they think they're eligible, but then they get denied. Mm-hmm. Is there a standard appeal process that Medicaid uses that you'd be using for this new population, or what's the process? Because there are bound to be some that say, I thought I qualified for this, but they tell me I don't.
Yeah, so we're establishing kind of rapid response teams to be able to address those situations. And so it's a work in progress to ensure that individuals who are qualified actually get the services they need and get the information they need in order to determine whether or not they do qualify.
And I guess the other side of that, and again, thinking about the diverse opinions that were expressed back during the legislative session, do you see issues of fraud that sometimes are thrown out as connected with Medicaid, even say more than with Medicare, I believe? Are there safeguards you think that would be in place so that everyone who should receive it would be able to receive it, but if I'm not eligible, then I shouldn't be receiving it?
So DSS and DMAS are working on an auditing system to ensure that individuals who are receiving Medicaid are qualified to receive Medicaid, and kind of our frontline workers are also being trained to make sure that the determinations are as accurate as possible.
And that income requirement is always going to be the first threshold.
Mm-hmm. And hopefully some would receive raises in their income, and then that could even threaten their eligibility. It's good to get an increase in pay, but now this extra $100 or whatever kicks them over the limit, so there will be some challenges, to be sure. Before our time's out, Doctor, let me go to you first. What else should our viewers be thinking about in this whole process of expanding Medicaid?
Just ask the question, I think, is the message I can say. Like Mr. Figueroa said, go to the website, as I'm sure it's displayed several times. Go to the website, ask the question, see if you're eligible. If you're without care currently, see if this new expansion applies to you. And then if it does, use that to establish care with the primary care physician. Don't resort to the emergency room as your only source of medical care, because everyone will benefit from this expansion if we're able to provide patients with the right care in the right setting.
And excuse me, they wouldn't have any copay, is that right?
I think that's another item that's to be debated as far as what the potential copays would be. From the information I read, if there is a copay, it will be minimal. It's not some of the high deductible plans that we currently see. So that would certainly be a shift, and but like I said, I think that's to be determined.
Yes, because I would think they would want to come to you as a primary care physician in your primary care office rather than showing up in the hospital where you work, but maybe wondering, is it $5, is it $2, or how much am I going to be having to come out of pocket? So that.
The other thing I would say is the group, I also serve as a medical director for two physician groups, one that's in the Southside area, Southside Regional Medical Center, and then also physician groups that are associated with Southampton Memorial Hospital and then Southern Virginia Regional Medical Center. All said and done, we have over 50 physicians, a variety of different specialists, and we all accept Medicaid currently, and will do so in the future.
Excellent. Marvin, Senator Lucas, anything else in the last minute that you want to add?
Now, I'm just extremely proud of the way we're all working together to try to make sure that we fine-tune this process so that it makes it easier for people to understand and also to determine whether or not they're eligible. And in addition to going to the website, I've noticed that there's a lot on social media where people are having forums for people to attend to help them better understand it also. So we're just asking all those people out there who think they might be eligible just to seek out the information just to be sure.
Well, I think that our time is up, but I thank each of you for being on This Week in Richmond, and the best to you as this gets rolled out to provide health care to more people in Virginia. Thank you.
Thank you.
This Week in Richmond is made possible in part by the Virginia Education Association. An investment in teachers today will pay dividends tomorrow. Dignity Memorial. The Dignity Network provides professional and compassionate funeral, memorial, cremation, and cemetery services throughout the Commonwealth of Virginia. Virginia Hospital and Healthcare Association for jobs, the economy, and public health. Virginia Tourism Corporation, promoting why Virginia is for lovers, lovers of wine and craft beers, the outdoors, beaches, history, music, and more. Fall in love with Virginia at virginia.org. Additional support provided by these sponsors. And by the members of Virginia's public television stations. Thank you.